Could you do
Perfect.
how
How
for this next slide?
how many of you have air quality programs through your environmental program? Awesome. And how many of you are thinking of starting up your air quality program? Yay! Okay, so we're here to encourage you, of course, to do that. We're here to offer you our support. We're here if you need any technical assistance or any sort of information. We're here to provide that. So a lot of people don't realize that we have indoor air pollution that can be affecting us and our families. And while we're working really hard to improve outdoor air contamination and pollution, we can also be doing things indoors to improve the air that we're breathing. And of course, this is very important because we spend 90% of our time indoors. So this means that a 10-year-old child has actually spent the equivalent of 9 years in an indoor environment. And when we talk about indoor environments, we're talking about schools, daycares, anywhere that you really are spending a lot of time indoors. And now, more and more, with this extreme weather that we're experiencing, like dust storms, extreme heat, wildfires, we seem to be spending even more time indoors. And of course, vulnerable people spend even more time indoors, or our elders, our children, newborns, people with disabilities. So we want to make sure that our indoor air quality is as healthy as possible. And a lot of times, studies have shown that indoor air contaminants can be 2 to 5 times higher indoors than outdoors. So that's really important to know and to share with our communities. So there's a lot of health effects for indoor air pollution, and a lot of times you may not realize that, when you feel headaches or dizziness or fatigue, it could be due to the indoor air that we're breathing. And of course, we also have a lot of long-term effects. For example, radon can cause cancer long-term, and these contaminant exposures indoors can also cause cardiovascular and respiratory impacts. And wanted to also put a plug in. There is going to be a presentation at 9:30 on mold to talk more about that specific issue. Mansel's going to be giving that presentation, and then also at 10:30 there's going to be a presentation on how to start an an air quality program through GAP. Okay, so here are some common contributors to poor indoor air quality. We're all very familiar with them. Or maybe not, right? Sometimes our communities aren't familiar with all these sources of poor indoor air quality, especially outdoor contamination and how it comes indoors. Particulate matter, for example, comes, inside our homes, but there's also a lot of sources of indoor air particulate matter that we create ourselves, or we may not know are there. Um, Here's a graphic that shows the width of a human hair, and the little red specks are the PM 2.5, and they're so tiny. You breathe them in, they go into your lungs, and they go sometimes straight into your bloodstream. So here's some indoor sources of particulate matter that we may not even be aware of, and a lot of communities also aren't aware of. I'm going to breeze by quickly because we have a lot of information to cover, but just a few here. For example, the outdoor air sources. So if there's a wildfire or a big dust storm, all that comes indoors. And this is all home examples, but of course this all applies to schools as well. Okay, and just some of the health effects of particulate matter exposure indoors. It can worsen asthma, decrease lung function. It can also cause non-fatal heart attacks, which is really scary, and premature death in people with heart or lung disease. And of course, we're here to encourage you to really consider working on indoor air quality, sharing all of this information with your communities, so that we can protect our most vulnerable populations. And I think that's where I'm going to end it, since we are running behind a little bit. And now I'm going to turn it over to Laura to talk about children's environmental health.
Hi, everyone. Thanks for being here. I'm Laura Block. I'm the children's. Hello. Ooh. Okay, so I am going to talk a little bit about children's environmental health and what it is. So, children's environmental health concerns the effects of the environment on a child's growth, on their wellness, on their development, on the risks of disease at all life stages, and we are focused on protecting children everywhere, where they live, where they play, where they and why are we focusing on children? Well, children are not little adults. There are differences in terms of their behaviors and in terms of their biology. So, this shows, for example, that children eat more, breathe more, and drink more than adults. Proportionately, so if there's a contaminant in the air they're breathing, they're getting a higher concentration of that contaminant. There's also different life stages with children. They There are periods in a children's life when they are more susceptible to certain exposures. So, for example, the first 9 months of life, when their blood and lungs are developing, they're particularly susceptible to carcinogens. And it's not just kids because lungs are developing for the first 18 years of a child's life. EPA has actually changed the definition that we use for children. And there are health disparities. While these contaminants impact children, all children, they're particularly um, harmful to children in disadvantaged communities, to minority children, to children below the poverty level. So, for example, a Black child is 5 times more likely to have elevated blood levels than a white child. Um, Low-income children are 4 times more likely. Children with empty stomachs, so looking at children below the poverty line, blood is um, blood is absorbed into the blood on an empty stomach more, and nutritious food actually helps decrease the amount of absorption to the child. So if the child is hungry and not getting nutritious food, they're going to have a higher incidence of elevated blood. And then if you look at asthma, children that are um, minorities are up to 50% more likely to have asthma, and Native children even more so. And asthma is the leading cause of school absenteeism. And asthma also, if it's uncontrolled, it impacts the child's sleep, um, ability to recall, memory, and so they don't do as well in school. And you can see that that impact is very harmful. If you're not doing well in school, it can impact what happens after school when you enter the workforce. So these exposures lead to health outcomes, and these health outcomes lead to impacts. And the point to make here is, while it's horrible what happens with a child and the child's family, it also is horrible what happens to the community and society at large. So, for example, there's an exposure, and this leads to things like asthma, to developmental disorders, like ADHD. I mean, I have an ADHD child. You know, there are challenges. Leads to problems like even childhood cancer, obesity, things along those lines. And then the impact, the long-term impact, because there are short-term and long-term impacts, could be on things like absenteeism, um, poor school grades, and then leading to things a variety of ways. But if we just look at the economics, less lifetime earnings, and things like needs for more special education classes in schools, and increased healthcare costs because there's these exposures, there's these illnesses that can become chronic if they're not, first of all, decreased and eliminated, if at all possible, these exposures. These are some of the priority areas that we've been focusing on for US EPA, for children's environmental health, as healthy schools, which is sort of the focus of today, looking at indoor air quality in the school environment. Kids are spending a lot of time in schools. And I think one point I always like to make is if we're protecting our children and our most vulnerable, that means we're protecting everybody. So that's something to keep in mind, I think. So children spend a lot of time in childcare and in school. They're spending 90% of their time indoors, and a lot of that is in these areas. And there are a lot of exposures that are. And so, how do we or eliminate these exposures is really important because these are the kinds of contaminations that we're dealing with. Pesticides when the kids are outside playing. Um, all these outdoor airs, as Ali was showing, comes indoors. So the indoor air quality is worse because it's the outdoor air plus whatever's happening indoors. And now it's my pleasure to introduce Chase Choate, and he's going to talk about his work with indoor air and air quality in tribes.
Oh, Susan's track. So, yeah, use the microphone because they're broadcasting.
Yes. Hello, good morning, everybody. My name is Chase Choate, Environmental Director for the Quechan Indian Tribe. And today I'm going to discuss my outreach that I've done with our Native community. But first, I want to start out and recommend a couple of trainings through ITEP. Fall of 22, I took 2 trainings at ITEP. One was air quality outreach in tribal communities. The other one was indoor air quality in tribal communities. Those 2 were really great trainings because we got some toys that we got from there. Everyone likes gadgets, and they gave us a long-term loan on these items. This one's a PM 2.5 tracker that I have on, and you can sync it to your phone so that you can have a graph and see exactly. And this is kind of like your AQI, color coded. So yellow being moderate, but it's okay. And we have and then the next training we got a CO2 checker. So right now we're at 416 parts per million, and that's a great reading for the room and having indoor air quality. But yeah, that training, we gained a lot of knowledge, and we actually went to a school and we actually went to an apartment complex to kind of do our own little investigation, um, uh, checking out air quality sources. So in the home, your hood of your stove might be one source, making sure you have that proper ventilation. Your shower, making sure you have proper ventilation in the shower, not having too much moisture, creating mold. So all those aspects are tied to indoor air quality. And at the school, the water fountain, I guess it was leaking, and that can create some mold on the carpet. So that's small little things that you need to be aware about. We also went into the kitchen and of the school that we did some, little assessments, but the hood of the stove wasn't working. So that can be, making the workers and the cookers ill. So it was a very in-depth training that we kind of learned all these concepts, learned all, on hands-on. It's about being hands-on, and that's the best way to learn. Next. So from ITEP outreach to San Pasqual Valley Elementary School. So our community was a mix of Native and Hispanic students, Latina students. And in late winter of 2023, I was able to bring Mansell Nelson from ITEP to our reservation. And he did a lot of activities with the students, teaching them about air quality. And again, it's about having a hands-on approach to teaching and the students learning. We did mock classroom inspections using these little items that I showed you earlier. One thing I did notice is the CO2 was kind of high in some of the buildings, some of the classrooms. So I recommended having a better ventilation system, whether it's HVAC, having fans, creating your own fans with the filters on them, opening doors, things like that. So I started this outreach Saturday school with the elementary school, and I've not only taught them about air quality, but I'm teaching them a bunch of things. My background's in wildlife biology, so I'm kind of like trying to raise some biologists back home. So anyway, I'll take them out. I've taught them how to use a compass, orienteering, mapping. Um, what else have I done with them? The school bought them binoculars, so we're out there learning the flora and fauna of our reservation. So that outreach and that being there and the kids knowing me, now they call me Teacher Chase. So that's pretty cool. There's one student there looking at, probably looking at the sun, but bird watching. And so through this volunteerism, they're getting to know me. They're gaining their trust. And again, when I come back and I do presentations in the school, they're like, "Hey, I know you. You're Teacher Chase." And I also set mammal traps when we go out and do our Saturday school, and they're always excited. "Oh, set the traps again, set the traps," catching little live mice, live rats, and things like that. Just things to keep them, engaged. But we also had our Earth Day planting event and teaching them about carbon sequestration, and planting trees is better for the environment. And, they had a blast. I think we kind of did a lot of planting. We took a break, and a few of them wanted to keep going. And I said, "Are you guys having fun?" They're like, "Yeah." So, that just brightens up my day to make sure that they're happy. They're learning about air quality and other environmental things to be aware of on our reservation. Um, so I also know that repetition is key. And so I've probably presented to some of the classrooms over and over again, but that's the way it's going to stick, learning that AQI, what that is. And I actually, one day I burned a little napkin and put it in a glass jar, and I had this PM 2.5, and you can see it turning purple. So I want them to actually see that what harm can do. And so making sure that these little tools change and how it changes, they can actually see that, and that's gonna, stick with them. So, hearing information 7 times to know, to really understand it, using these sensors to physically see, and then by actually physically seeing it, they can see the real risks. And then I also finally got flags for the schools, elementary, middle, and high school for the flag program, EPA flag program. So did a lot, still doing a lot. The kids are saying, "When are we going to go hike again?" And, so I'm going to meet with the school when I get back and plan our schedule, our events again, and keep popping in that knowledge, and especially about air quality. So my information real quick, and that's from our planting event. So all smiles. So that's what we want from our children. So with that, I'll hand it off to Mansell Nelson.
Chase is right. It's a lot easier to teach kids to do the right thing than it is you adults. So I work for the Institute for Tribal Environmental Professionals, and one of my roles is the education and outreach, which is why, hi Delbert, which is why I've spent some time with Chase in the schools. And I have the long view, as in I'm not going to solve all the problems today, but in the next 20 years, the kids I teach are going to solve the problems. Because the reality is adults have a real hard time changing habits. But my portion of this presentation was to talk about some tools that we use for work in schools. So one of my tools is a checklist, and this is a EPA document. The reason I like it is it's short, but it gives a good start on some key issues that we need to address in schools. And this is available online. just sensible steps. Type that in, EPA, and you can download the PDF. If you can get printed copies, which is getting harder and harder to do these days, that's another good way to get a hold of this publication. And the other one, also checklists, but this one's about a ream of paper. So goes up in scale, much more detailed, and needs to be updated. So where's Sakoti? There he is. So it's on my wish list to get Oriya to do an update on this. So if anybody wants to join the group doing the update, I solicit your input. So Chase, I'm expecting you to sign up. And maybe Emily back there. Yeah, are you working on your schoolwork or are you paying attention? So the Tools for Schools program, I've been using it for a long time and I do recommend it, but I want to see some changes and updates to it. But it has lots of information. Of course, you don't really get the printed copy anymore. It's all online. I think I have one printed copy back at the office that I still hang on to, but before I could still get printed copies, I handed out hundreds of these. Now it's just get it all online, including the various checklists. And they have checklists for kind of targeted for different audiences. The classroom teacher, and by the way, I'm a former classroom teacher, so there will be homework and there will be a quiz, so pay attention. But there's also checklists for, the different functions in the school. So, and this more on the checklist, and I like to remind people that our visual senses are an important part of the tools that we need for building assessments. I'm often talking to people about instruments, and I say, well, let's open our eyes. Let's smell. If you can taste it, we're really in trouble. But let's make sure we're using all of our visual and observational. And people kind of expect that there's going to be an instrument they can plunk down and it's going to give them the answers. Well, I think that's still like 50, 60 years away, personally. I mean, AI combined with some instrumentation, maybe it'll get there in a few decades, but I don't think it's going to happen for a while. We need to open our eyes, we need to visualize, we need to look, and checklists can help us with that process. And the Tools for Schools goes on with lots of other technical advice and such. So you want to take a look at that. And again, it's all online. But my favorite part, not necessarily the most important part, but my favorite part is some of the tools like Chase started introducing. And by the way, our budget was bigger in 22. And lately, my boss has not let me give away the instruments. But you can still come to the training. I mean, and in fact, we do travel scholarships and stuff. But he's not letting me give away the tools anymore. So you made it lucky, Chase. I just want to note on my way to talking about some of these tools that there's 2 states, one of which we're in right now, that have passed legislation to have monitoring going on in all classrooms. So I'm looking forward to the other 48 states catching up. But I think it's a good first step, emphasis on first step, as in it doesn't solve the problem, but what it does is it creates awareness of the problems, or it's a reassurance. Hey, our ventilation's doing okay. That's always reassuring. But if you want to check out what California and Nevada have done, these are some links to the information. But So getting into some of the tools, Chase mentioned the CO2 check, but I've got a couple other instruments here, all of which that monitor carbon dioxide, which just to make sure you know where that's coming from, there's a baseline outside of about 400 parts per million. And then from there, we're breathing. So I've got some good news for you all here. There's somebody in here that's alive because we're producing carbon dioxide. It's a little on the high side according to this instrument. And by the way, if you do like all the kids do and blow on it, yes, it's going to go very high. My wife did it, and I said, yeah, all the kids do that. But, and you can pass that on around and back. But that's one of the instruments that I use. But Chase mentioned the CO2 check. Can we borrow yours? I didn't get mine charged up. So this is another device. I've really gotten excited about the low-cost sensors that are now available because I used to be really hesitant to put instruments in the hands of students because, you know, they're expensive, they break them. Now they're a little cheaper. They still break them, but, you know, it doesn't cost quite as much to do replacements. But measuring carbon dioxide, you know, it gives us a number of benefits, but there are limitations. Just because your ventilation is good doesn't mean your air quality is good. So, got to correct Chase a little bit because, well, now what did you say? If he said the ventilation is good, then he's right. But that doesn't mean that the air quality is good. That's a really important distinction. And so, and that's part of, you know, the bigger picture of we got to be aware of what's going on in the space. For example, if there's odors, the CO2 is not going to tell us about those odors. But as I've visited schools around the nation and visited literally thousands by now, I've been doing this for 25 years. There's schools I've been in where I've literally had to turn around and walk out. I'm one of the victims of asthma, not childhood asthma, but adult asthma. And so, you know, there's literally schools that I can't operate in. Or there's schools, like in one situation where I turn to the custodian and say, you know, we were doing a walkthrough, and I told him, man, I'm having a hard time breathing. And the custodian looked at me and said, well, you can go home. Like, yeah, I know. But my point is the kids are supposed to be in school. And what the custodian didn't fully comprehend is there's 8 kids out of 100 going home every week due to respiratory problems in that school. And my lungs were telling me why. And the CO2 check helped give a little bit more information, but the reality was cleaning practices, at least in the dining area. They were disinfecting the heck out of that place, and including attempting to disinfect the air using chemicals, which doesn't work and just makes kids sick. So you got to pay attention. You know, even though we have these instruments to give us some information, there's limitations. Another limitation with the CO2 is it only works when people are in the room. I can measure an empty room all day long, and it's not really useful information. Schools sometimes will say, well, come and do your. I said, well, I can't assess. I could assess a lot of things, but I can't assess ventilation because you got to do CO2. Well, it's a normal operation, normal occupancy, that kind of thing. Now, since our CO2 is a little bit high, I need about a third of you to leave the room. So, bye. Nobody's leaving. Oh, well, I tell the kids that, and they all volunteer. But that is one way to improve our ventilation is just get people out of the room. But I guess it's not going to work today. Yeah, that works too. Yeah. Make sure you hold it for the next 20 minutes. All right. Numbers wise, they've changed recently. And I finally have CDC agreeing with me. Now, sometimes when Mansell says that's not quite good enough for some people, but CDC actually agrees with the numbers that I'm presenting. But before the pandemic, we used to say basically anything below 1100 is okay. We'd call that a well-ventilated space. But during the pandemic, we learned about these little viruses that are transmitted around. And based on a lot of folks working on the issue, the levels should be lowered down to less than 800 ppm. And the difference is at 1100, you're rebreathing, listen carefully, you're rebreathing 10% of everyone's air, okay? At 800, you're rebreathing 1%. So it's a full magnitude less rebreathing you're doing, which includes the viruses that some of you brought into the room. So it's an important recognition of ventilation that is of protective level. And I like 700 even better. But it's more expensive, of course, when we start ventilating at lower levels. Reminder that outdoors is approximately 400. And CDC, and I got this from Harvard, some of the work they were doing, but CDC finally agreed with me. So now they use a little different term. They say 4 to 5 air changes per hour. But if you do a little math and a little bit of creative thinking, I came up with the 800 and 700. And it's not just Mansell. If you care, it's also Harvard University. They've got a program there for health and buildings. Some instruments that we use, one's being passed around. The other one's another one that I've if you are making selections, which I often talk to people about this and advise them on it, you definitely want to look at cost, but also what do you get for the cost? So I typically ask people, what's your budget? And then try to figure out what kind of instruments will fit within that budget. And sometimes I'll say, it's just not enough. So don't worry about it. Do something else with your money because that's not going to get you much. But based on a budget, I can help you kind of plan. And it's not always exactly the more you spend, the better you get, but there's kind of a rough correlation there. So you might need to increase your budgets a little bit. So another instrument, and again, Chase showed us one, and I noticed that when he showed it to us, it was glowing yellow. So maybe he was walking around too much. You want to put it on the floor, Chase? Yeah, go ahead. I'll let you dance. One of the favorite things for kids to do is dance, and Chase is going to demonstrate. Oh, yellow, red, not purple. Come on, dance more. All right, we got it up to red. So if you know your AQI, that's not very good. And that's a vivid demonstration of why I don't particularly care for carpets. And kids spend, especially younger kids, spend a lot of time closer to the floor and on carpets. But even for us adults, carpets are a great source of contamination that can affect us. So, and that's why I would let Chase do it, because I'd get an asthma attack doing that. That's AQI probably. Yeah. So yeah, if you switch it over, you can get the PM 2.5. So particulate matter measurements are a little bit more nebulous. I mean, 0 for particulate matter is a great number. If you got anything above that, then you can always, like, can you do better? Be the question I'd ask. But also, you want to be reasonable. I keep my home between 0 and 1. I run 3 HEPA filters and a humidifier 24/7, and I can keep my house between 0 to 1, except when my wife's cooking. I don't cook. And then she shoots it up to a couple hundred for a few minutes, and then got to filter it back down. But and it's also not a direct measurement of something like viruses that we're particularly concerned about, because we don't actually know what we're measuring. As far as we know, it's particles, but we don't know specifically what kind of particles. But it's also great for wildfire. But the EPA does have some standards just for outdoor air. Although I've been bugging Sakoti that we need some guidelines for indoor air. We're going to come up with those, right, Sakoti? Okay, so did you everybody hear that? You're my witness? Okay. So, as I said, lower is better. One thing you can do is compare inside to outside. You want inside to be better than outside if you can, possibly. And it can be an indication that something's going on. I remember one school I did, there was a whole way, just had, couldn't really figure out, but I did the first thing, which was go walk outside and realized that there was a dirt road near the HVAC, and there's pretty steady traffic going back and forth. And we were picking that up on the inside, being sucked in through the HVAC and added to our air. So, things to think about is, could we move that dirt road away from the building? It was right next to the building. So I talked to the school staff about, could we move it away? Could we build a sidewalk so that there's no dirt there for the vehicles? So, but it gave us something that we could identify and then start working on to see if we could make a difference. And we could see that on the inside of the building. And there's a lot of different monitors here. Chase showed you one. Here's that one that's a little over $2,000. I hesitate to give that to the kids. I might even hesitate to give it to you, but I'll give it a shot. So it's currently sampling, and as you pass it around the room, you can push the start button if it's stopped, and you can see our PM levels in here. And, many different devices for doing PM. And the last batch of instruments that I just purchased last week, there's a company called, and I don't endorse any specific company, but I will share with you what I'm getting. So there's a company called TEMTOP, TEMTOP, and I got some PM sensors for $45. So I bought 20 of them. So when Chase stomps on it, I can replace it. And I've actually used the devices for, about 2 years now, and compared them to some of the other devices and stuff. And, there's some quality control issues. I'd say about, what's that time? I don't have my glasses on. I can't see it. All right, 5 minutes. I'm the presenter for the next hour too, so we're just going to keep going. But anyway, so again, a lot of different devices, and look at your price. And like I said before, higher price might be a little better, maybe more features, maybe a little more reliable, maybe. But at $45, I can afford to get a lot and get them out in the hands of people. And I think they give us useful information. But, again, we need to be a little cautious and look at the numbers and think about what it's telling us. Purple Air, most of you are aware of these because they've been around for a while and they're pretty popular. I've been trying to get them into schools. There's the indoor version and the outdoor version, and they have a new one now that I just bought 4 of them, but my staff are working with those. PM monitor, they're static. So in other words, you set them up and then they can't move around too much. But I've put some in classrooms, science classrooms, and then from Flagstaff, I can monitor what's going on. So one day I was looking at one of my schools out on Navajo Nation, and they had really high, it's like, AQI of red or something. So I gave them a call and said, hey, what's going on in your school? Well, it turned out in the chemistry lab, they'd blown something up and had a little fire and a little excitement. And of course, it contaminated the entire school. So that was interesting. My granddaughter used these for a study that she did to look at her family living in Monument Valley, Navajo, to see where how wood stoves were impacting air quality. Then one of my favorite instruments, and the kids actually like this one the best, is my smoke puffer. They for a while they were calling it a dragon puffer, and I like that even better because in my personal life I'm the dragon master, but it helps us see the air movement. So we're not going to see much right here, other than good thing I took a shower because the air is moving your guys' way. But I test doorways to different classrooms, bathrooms, that kind of stuff. So if we didn't have such a big group, I'd go out to the bathroom. Which way do we want the air to flow if I'm at the bathroom door? I told you it's going to be a quiz. We want it where? Up? Oh, you want it up and out, right? Okay. So not coming out the door, right? So when you go and do things in the bathroom that we don't talk about in polite company, but it stinks. And we want it to go out of the room, not out into the hallway. So this helps you investigate that. And I can tell you from working in schools that I'd say about 60% of the fans are not working, even if they're making lots of noise. In fact, if they're making lots of noise, they're probably broken. But I've tested hundreds and hundreds of fans. I remember one school up in 2 minutes. I remember, I don't have time for all my stories. But anyway, I was doing a school up on North Slope in Alaska, and I happened to see one of the maintenance engineers, and he asked me what I was doing, because I'm poking around. I told him, well, one of the things I'm going to do is check all of your exhaust fans. And he said, oh, well, they're all working. I said, well, okay, I have time. I'll just go ahead and check them anyway. And 2/3 of them were not working. And this tool here verified that. And so I went back and told him, and he looked at me in dismay and then went to do some investigation and such. And a couple hours later, he came to me and said, check it for me again. And how do I get one of those things? So he was able to find the circuit breaker and such, and he found the fan that broke and flipped the electric circuit breaker, which happens all the time. And of course, like all these other measurements, there's limitations to it, but it gives us a lot of information about what's going on with the air, and particularly useful in the school. So one thing I will warn you, if you go online to buy a smoke puffer, you might come up with one that is made with titanium chloride. And to keep the chemistry simple, I'll just say that's a very corrosive chemical, and you don't want to breathe it. And I lost one in a school. Yeah, that's what I said. So I did find it, no lawsuits. And since then, I've always used this one. So if the kids drank the fluid, I suppose they'd get diarrhea, but at least I'm not burning fingers and blowing things up. So that's what I use in schools, and it's primarily for protection of the kids. And what did I do with my clicker? All right, I'm close to the end because I'm out of time. There's a smoke puffer, and there's my contact information. So happy to discuss with you anything about indoor quality that I can help out with. And as many of you know already, I love to come and work directly with participants on at your community, right, Christy? And Emily, wherever you are, you still doing your homework? You about got it done? And Chase and Delbert. And I did a workshop in Lone Pine, but I need to go back and do a school or something. So, all right. We're out of time, but we can take questions. If you want to stick around for a few minutes, mold is next. So, but we can take questions, or of course, many of you want to go to another session. I can't imagine why you'd want to, because mold is so fascinating. But if you need to go to another session, go ahead. But questions from anyone? So we either covered the topic really well. Yes. And we have a microphone somewhere, but I guess you do mine.
Thank you. Question I have has to do with the, I think you show me, is it on? Okay, everybody here. Okay, is the ACHs, which is the turnovers of the air volume in the house, in the home. Could you kind of explain that to the groups? They, kind of understand the magnitude of that?
Yeah, so he's talking about air changes, which HVAC guys will refer to air changes per hour. That's replacing the air in the space a certain amount of time per hour. So 5 times per hour is pretty fast. That means that every 20 minutes, you're fully replacing the air in that space. And 1 air change per hour would be, you're just changing 1 time per hour, which that is pretty low ventilation. So that's a terminology they use a lot. Yeah, Delbert.
Okay, when the CO gets elevated, by turning on the fan, does it help?
Good question. And did you mean CO2 or CO?